Cliff and his wife Debbie tend a ranch. It's a 24/7 responsibility. Any time away from home means work doesn't get done. Like many who live in rural Oklahoma, access to health care is an increasing problem.
I'm not sure that many people understand the severity of our physician shortage in Oklahoma and really the impact that that has on our state and even our economy. Oklahoma ranks 47th in the United States for the number of primary care physicians per capita. And when you think about the rest of the United States and you look at states that have the higher number of primary care physicians per capita, they live longer.
Cliff's father had a heart attack a few years ago. That heart attack got everybody in the family's attention. Cliff now has regularly scheduled checkups with his doctor on the book, but finding time to go into the big city is a problem, and it's expensive. One highly successful program is Project Echo, where primary care providers are linked with specialist teams at OSU-CHS to manage patients who have chronic conditions requiring complex care. We provide this resource at no cost to rural providers. Project Echo has service lines in mental health, addiction, childhood obesity, and HIV hepatitis C. We are working on new initiatives that would make access to care more readily available to rural Oklahomans. A virtual healthcare system will allow rural patients like Cliff to see an OSU doctor right in their own community.
Well, hey, good afternoon, Cliff. How you feeling today?
Now with a virtual clinic nearby, a doctor's appointment doesn't mean a long drive into the city or a day away from his ranch.
One of the other things you can do, and I just happen to know you like your cheeseburgers and big Cokes, you're going to need to work on that because that just is not good for your blood pressure.
It's a tough one, Doc, but I'll do my best.
The OSU system has a very unique asset in that there's a presence in every county in our state through Extension.
These local access points are a trusted resource for rural Oklahomans. Virtual clinics here would ease the rural healthcare shortages, helping us better serve and fulfill our land grant mission.
You know, this is a two-way street. So certainly I'm optimistic that the experience we have in cooperative extension and the resources that we have can be helpful to the Center for Health Sciences in reaching healthcare needs in rural communities. But I'm already seeing how watching others adopt practices and sort of invent cooperative extension from their own perspective, it's giving us insights into how we can be better at doing what we've been doing for more than 100 years.
Virtual clinics could also be a valuable tool in easing other healthcare problems in our state, like mental health.
It's particularly necessary in terms of treating mental illness and addiction. Getting medication-assisted treatment into primary care offices, ensuring that we're doing screening at every opportunity for Oklahomans who may be struggling with untreated depression or substance use or abuse is critical. Working together with OSU to ensure that this new frontier, virtual medicine, whether it's through the ECHO project, medication-assisted treatment, or other joint initiatives, is going to be critical to reaching all areas of the state.
How do we improve our virtual care? How do we connect to critical access hospitals across the state and utilize the physicians that we have and in our hospital, in our emergency rooms, to provide care for patients where they need it? In our minds, we view a building, it's a hospital, we view clinics, and we see patients traveling to those locations to receive care. But as technology is changing and our landscape is changing, it's time for us to rethink what a health system is. And with the technology the way it is, we have an opportunity to create a health system without walls. A health system that goes to the patient rather than the patient coming to us.
A virtual healthcare system and sticking to the plan his doctor has made will keep Cliff and others healthy so he can be around for years to come.